So let's briefly look at how to diagnose ectopic pregnancy, how doctors confirm the condition. But before we move, do not forget to like and subscribe for more videos. So ectopic pregnancy occurs when a fertilized ovum implants outside the uterine cavity, most commonly in the fallopian tube. Early diagnosis is critical because rupture can lead to life-threatening internal bleeding. Diagnosis is based on clinical suspicion, laboratory tests, and imaging. So let's look at the clinical history. A high index of suspicion is important in any woman of reproductive age with amenorrhea and abdominal pain. So amenorrhea is the absence of menstrual bleeding. Common history findings in ectopic pregnancy include amenorrhea, which is usually 6 to 8 weeks, lower abdominal pain or pelvic pain, vaginal spotting or bleeding, history of infertility, previous ectopic pregnancy, previous pelvic infection or pelvic inflammatory disease, use of intrauterine contraceptive device, that's IUCD. So let's look at the clinical examination, what you find in clinical examination in ectopic pregnancy. On general examination, you should see pallor if at all there is already internal bleeding, tachycardia, that's elevated heart rate, hypotension, especially in ruptured ectopic pregnancy. On abdominal examination, you should expect to find lower abdominal tenderness, guarding or rigidity, signs of internal bleeding. Pelvic examination should show cervical motion tenderness, adnexal tenderness or mass. Uterus usually appears smaller than expected for the gestational age, and you should expect to find fullness in the pouch of Douglas. So you do a pregnancy test. A urine or serum pregnancy test is usually positive. So a beta HCG test in ectopic pregnancy, you will notice that beta HCG levels, that's beta human chorionic gonadotrophin levels, will rise slowly compared to how it rises in normal pregnancy. So you do an ultrasound examination, which is the most important imaging test. Here you do a transvaginal ultrasound. Findings may include no intrauterine gestational sac, adnexal mass, extrauterine gestational sac, that's you may even find a gestational sac but it will be outside the uterus. Then there might be free fluid in the pelvis, that's blood. So you could also do a codosynthesis, which is less common these days. A needle is usually inserted into the pouch of Douglas here to detect non-clotting blood, suggesting ruptured ectopic pregnancy. So if you insert a needle here and withdraw and you see non-clotted blood in your syringe, that means that there's a likelihood of an ectopic pregnancy. So you could also do a diagnostic laparoscopy. So laparoscopy can directly visualize the ectopic pregnancy. It is considered a gold standard when diagnosis is uncertain. So when you have tried all other methods and you have still not ascertained ectopic pregnancy, you can carry out a diagnostic laparoscopy which will unveil everything. So well, let's move to the classic trials or examination. So in ectopic pregnancy, the classic triad you expect to see is amenorrhea. You see amenorrhea, abdominal pain or tenderness, and vaginal bleeding, sometimes called abnormal uterine bleeding. So when you think of how to diagnose ectopic pregnancy, you should think of PAST. P is for positive pregnancy test. A is for abdominal pain. S is for scan, ultrasound to be specific. And T is for tubal mass. So, in a nutshell, ectopic pregnancy is diagnosed through clinical suspicion, positive pregnancy test, and confirmation with transvaginal ultrasound. Thanks for listening. Do not forget to like and subscribe for more videos. Elite Med Hub, elevate health and mind.